There's three basic different approaches to doing a lobectomy or a lung resection. The traditional way of doing the surgery is what we call a thoracotomy. A thoracotomy is an open incision. We can pretty much do the surgeries now through maybe a 3-inch incision. The second lung procedures would be with what we call thoracoscopic. Now, thoracoscopic means it's through a television camera. And the advantage to that is it's a much smaller incision, a lot less pain involved. If we talk about the thoracoscopic procedures, then we kind of can take it a whole nother level higher to where we can do it with a robot. When we do the procedure through what we call ports that we use for the thoracoscopic procedures, we typically tunnel the ports upward and then we enter in between the ribs that way. It's a source of pain post-operatively, and that's just part of the procedure. What the robot does is it has a computerized spot that's on the trocar, so you go straight in, and it computerizes and locks it right to that center, and so it does not torque on the tissues or the ribs at all. So there's a lot less trauma to the tissues, a lot less trauma to the ribs, there's a lot less pain. Now, another big advantage to the robot, the video equipment in the robot's remarkable. The robot's full three-dimensional, so when you put your head in, it's like virtual reality, and the optics are amazing. The robot itself, you can move the instruments in 7 different degrees and angles. I can move the robot hands in more angles than I can move my wrists and really get into those small spaces that you need to get into. What's nice about the computerized equipment is that there's a certain amount of hand tremor. Somebody always has, some people drink coffee, the energy drinks and stuff like that, but you always have some kind of a certain amount of hand tremor, and so what happens is it'll cancel that. So when you're working on some of the fine, delicate tissues, you don't have that same hand tremor that you do. Also, you have to realize that the robot that we're using has 4 arms. One of the arms typically you put the camera in, but then you have 2 other arms. You can switch back and forth rather easily. With the advanced technology of the robotic procedures that we're doing and the thoracic procedures, we are the first in this entire area to be offering this to the patients, and I think this is going to take off and really be the standard of care in the future.